pointed tissue. Be specific. Dense, regular, connective tissue. So how do you describe dense, regular, connective tissue? You have more fibers, collagen bundles, more of it, and less of the ground substance and cells. Okay, the cells here are just this fibrocyte. Yan. This is the nucleus of your fibrocyte compressed into slit-like or cleft-like structures. Yan. So this is dense, regular, connective tissue. Okay, some tissue is easy to identify, some tissue not so easy. That's why practice. Okay, dense, regular. Okay, classify pointed tissue. So when you classify, start from the general. What's the general? You have only 4. So you have to decide among the 4. Is it epithelium, connective tissue, muscle, or nervous? So this is what? Muscle. Okay, you have already half point. Now, specific, what type of muscle? Skeletal. Okay, this is skeletal muscle. Okay, how do you know it's the skeletal muscle? The nucleus is located at the periphery. Okay, it is cylindrical and non-branching, and also it's striated. Okay, this is the cross-section of skeletal muscle. But we will not show you that in the practical exam. We'll show you always the longitudinal. Okay, so just to show you that the nuclei are really located here at the periphery of the muscle cell. Okay, classify tissue, pointed tissue, be specific. Cardiac muscle. See, the difference is of the nucleus is it is in the center. What else? It is branching and what is this? You have intercalated disc. So, easy pag muscle, di ba? You have already identified the smooth muscle earlier. Okay. Okay, it's not clear when you don't choose the silver stain. But here, identify pointed structure, elastic fiber. Classify pointed or bracketed tissue, elastic tissue. Okay, see the difference? With just one word, you can make a mistake when you answer in your examination. Okay, from a reproductive organ, female reproductive organ. Okay, these are the two layers, but we will look at this layer. Okay, classify pointed tissue. That's the low power, this is the high power, still the high power. This is the cross section, this is the longitudinal section. Classify pointed tissue. Can you classify? Okay, it is composed of fusiform shaped cells with cigar-shaped nuclei, smooth muscle, Cross-section of the smooth muscle is longitudinal section. This is from the myometrium of the uterus. Okay, smooth muscle. Okay, classify bracketed tissue. Classify bracketed tissue. Stratified squamous epithelium, non-keratinized, because there are nuclei all the way to the topmost layer of the epithelium. Okay, classify pointed tissue. Classify pointed tissue. Dense, irregular connective tissue. Classify pointed tissue. Loose connective tissue. Classify pointed tissue. Stratified classify pointed tissue. Stratified squamous keratinized epithelium or dry type. Okay, these are keratinocytes that do not possess any more nuclei. Yan, these flakes of cells here. So, stratified squamous keratinized. Okay, still, that's the skin. Okay, identify whole tissue. Be specific. It's one of the demo slides in the laboratory. This is the inactive mammary gland. Okay, you have the connective tissue and the lobules. Okay, lobules of glands. Okay, your acini here. This is inactive. Okay, when it's inactive, you have more connective tissue and just a few lobules of your glands, acini. When it's active, this is the active mammary gland, you have less connective tissue, compactly arranged acini or the secretory portion. Yan. And your secretory portion, the acini, contains secretion in their lumens. Yan. These are secretions. So that is breast milk. This is the active mammary gland. Okay, active and inactive. Inactive, active. Okay, what type of gland is your mammary gland according to gland cell participation? According to gland cell participation, apocrine. So when it's an apocrine gland, Okay, a portion of your, the apical portion of the cell is secreted together with the product. Okay. It's better if you look at the demo slides in the histolab. Okay, identify the pointed cell. Identify pointed cell. Mast cell. Okay, mast cell is a connective tissue cell, one of the connective tissue cells. Okay, it contains abundant granules. That's why you see only dark structures inside the cytoplasm, and these granules obscure the nucleus. Okay, what are the content or what substances are secreted by your mast cell? Those are the content of the granules. Okay, it contains what? Histamine and heparin. And this is similar to your basophil in the blood, okay, in the bloodstream. Okay, this is a lymph node stained with argentapine, and this just shows you what type of, identify these structures, the dark lines. Okay, what are these dark hair-like branching structures? These are, did you see this in your slide box? You have this in your slide box because all of these pictures, I took this from your slide boxes. Reticular fiber. Okay, hair-like branching reticular fiber. Wavy elastic fiber. Bundles, pink, thick bundles, collagen fibers. Okay, identify the whole organ. Whole organ. Skin. Okay, you're almost always sure for this examination in histo. If you are asked to identify the organ, it's just the skin. Because you haven't had any other organ yet. Okay, this is the skin. Okay, identify pointed structure. Sebaceous gland. Classify pointed structure according to morphology. Classify pointed gland according to morphology. Simple, branch, simple, you have one duct, this is the opening, together with the hair shaft. Simple, branch, acinar. Okay, classify pointed gland according to gland cell participation. Holocrine. Holocrine gland. Identify, classify pointed gland according to the type of secretion. Type of secretion. Mucinous. Okay. So you have how many questions just for the sebaceous? Identify, classify according to morphology, according to secretion, according to gland cell participation. 4 questions agad. Identify pointed structure.
Ano tawag natin yan? Erector pillar.
Or this one. This is also that structure, the same. Identify pointed structure.
Erector pillar.
Identify erector pili. Okay, this is your erector pili. This is a muscle. What type of muscle? Smooth muscle. You should consider always your spelling to be correct. Okay, erector pili muscle. Just one change, one letter, it's wrong. Okay, identify bracketed structure. Identify sweat gland. Okay, classify according to gland cell participation. Merocrine gland. Okay, or eccrine gland. Okay, you have 2 types of sweat glands, the eccrine and the apocrine. Okay, this is the eccrine type. Okay, or the merocrine type of sweat gland. Eccrine and merocrine, they are the same. Okay, the apocrine sweat gland is found in the area of the axilla.